Kevin Crawl, a PT at Canyon Road, is going to be the pointer. And I also have to say that Kathy Guilford, and Don Kiss, and Sherry Durrell, those were the four that really built all of this yesterday. I had the painstaking task of cutting out all the outside windows. And man, when you're done with that last one, you are done. You don't want to cut anything else. But anyway, so huge credit to those guys. So what happened on the front end is we took the approach of we don't want any space dedicated to patients having to wait. We understand that we want patients flowing through the system. We understand that patients show up early. Sometimes it happens. I thought my appointment was at 1. No, it's at 1:45. So you have to wait. And if they have to. So initially, our corner here was squared off, and we wanted to utilize the cutout space there in the front of the building for patients to sit and look at their email or look at the the scenery or whatever as they're waiting for an appointment, particular appointment time. So instead of building waiting space into our area, it's already there where people can wait. The problem was our reception area, the way the wall was, didn't give us much view of that space. So in working with oncology, we said this will work out really well if we could corner off that wall and it would give us a nice view from our reception area. She's pretty pumped. So that worked out wonderfully well. We also talked a lot about, well, what do we need in terms of patient inflow and outflow, because we have a lot of serious patients. So patients that are coming in, this is their 12th time here or their 14th time here or whatever. So they can just come in, check in downstairs at a kiosk or something of that sort, and come up. And we're not checking them in here. We're just really acknowledging that they're here and then sending them on back. Yet some patients do come for evaluations. There's some paperwork that will have to be done. I think our vision is to have that done downstairs so they can come up, check in, and come on back. On the way out, a lot of patients, given that they have to set up series appointments, they're going to need to talk with our receptionist and do that function here at our desk. So we have that on the inside of the department for patients on the way out. Okay, so then we have an entry into our space. Initially, our space was configured differently. We had this piece that, I remember this right, came up, then came over, then came up, and we were fortunate enough to be able to acquire some additional space, which really helped us in our configuration. So we wanted to build in flexibility for the addition of services if needed. So we said we wanted at least one treatment or evaluation room that we could use for just a standard treatment or evaluation. We could also use to evaluate and treat lymphedema patients if that was a service that was going to be here. So we created a room large enough for that and built it adjacent to the patient bathroom that had a shower in it for that patient to be able to go back and forth. That bathroom can be accessed from outside as well. So we built that. And we also built that towards the front because most of these patients really, it's difficult for them to ambulate or to be transported. So we said, let's keep it as close to the front of the clinic as possible. The other thing we did is we said we want to keep as much structured pieces on what would be the left side of the space for you, so that if any expansion or contraction needed to happen with this space, it'd be a lot easier to do that if we didn't have things along this wall, because this is where that might be able to happen more up here, obviously not here. So that was another thing we wanted to make sure we did. The third thing we wanted to make sure we did was keep as much of the light flow through the entire space as possible, and we wanted to build some staff work area that could be modified into another treatment room or really their evaluation rooms. That's what we really use those rooms for, is to evaluate patients. We do use them for treatment for sometimes, but mostly evaluations is the reason that we have them. So this space was configured so that it could be modified into another evaluation room, so to speak, if that was needed. We don't know exactly what it's going to look like when we go to a complete electronic system. So we may not need as much of this space as is here now. If we can have some mobile workstations throughout the clinic, and that meets our needs, then we'll do that. Yeah, so over here then we just have our, your standard basic things you need. Dirty utility space up front, treatment or evaluation rooms, 3 of those, and then a clean utility space in the back. What we didn't build into this space is a staff bathroom or lounge or anything of that sort, because this is right there, right down the hallway.
For this whole floor?
It's actually for the whole building. So we're just fortunate enough to be on the 3rd floor and be that much closer. So we're really happy with this space. I think you've done a great job.